You have a headache right now. Maybe you don't notice it, but if you did, there is a small white pill sitting inside a cabinet somewhere within 10 feet of you that would erase it in 20 minutes. Your ancestors didn't have that. They had a broken tooth, a festering wound, a fever climbing past 104 degrees, and nothing. No hospitals, no antibiotics, no surgery, no anesthesia, no ibuprofen, no sterile bandages. For roughly 300,000 years, Homo sapiens lived, gave birth, broke bones, contracted infections, and survived. Or didn't, without any of the things you think of when you hear the word medicine. And yet here you are. That's the question nobody actually stops to ask. Not how did ancient humans die? We know they died. A lot. Young. Brutally. The question is, how did they survive long enough for you to exist at all? What did they do when a child swallowed something poisonous? When a hunter came home with a spear wound through the leg? When a mother's fever after childbirth wouldn't break? The answer is stranger, more sophisticated, and more human than you've been taught. Let's go back. Way back. Imagine it's 70,000 years ago. You're somewhere in what is now southern Africa. The Blombos Cave archaeological site, excavated over decades by researcher Christopher Henshelwood and his team, has already given us evidence of ochre processing tools, symbolic engravings, and heat-treated stone. Proof that the humans living here were not primitive grunting creatures. They were thinking people, problem-solving people. And one of the biggest problems they solved, over and over, across generations, was what to do when a body breaks down. This is the story of prehistoric medicine. And it begins not with a plant or a ritual. It begins with something so obvious you've been ignoring it your whole life. It begins with the body itself. Your immune system is not a modern invention. It is, in evolutionary terms, one of the oldest and most sophisticated biological systems that exists. By the time Homo sapiens emerged as a species, the human immune system had already been evolving and adapting for hundreds of millions of years. Before us, before our primate ancestors, before even the first mammals walked the earth. When ancient humans got a bacterial infection, their bodies launched a precise immune response. Fever to kill bacteria, white blood cells to identify and neutralize pathogens, inflammatory signals to isolate the problem, and tissue repair mechanisms to rebuild what was damaged. This is not nothing. This is extraordinary. A 2019 review by researchers at the University of Cambridge found that for most bacterial infections in otherwise healthy adults, the immune system's response, without any pharmaceutical intervention, is successful roughly 60 to 80% of the time. Your body, if it is fed, rested, and not re-exposed, can clear a significant portion of infections that would have been death sentences in the 19th century simply because of how precisely tuned the immune response is. Ancient humans were healthier in certain baseline ways than people who came later. This is the first counterintuitive fact you need to hold on to. Hunter-gatherer populations, studied across the 20th century by researchers like James Woodburn among the Hadza of Tanzania, and by Richard Lee among the San people of the Kalahari, showed physical health profiles that shocked early anthropologists. Skeletal analysis of pre-agricultural humans reveals low incidence of dental cavities, lower rates of bone infection, and far fewer signs of chronic nutritional deficiency compared to early farming populations. When you eat a wide variety of plants, insects, roots, fruits, seeds, and animal proteins across a diverse landscape, your body gets the micronutrients and antioxidants it needs to mount a strong immune defense. Ancient humans were not walking around malnourished by default. The popular image of the starving, disease-racked cave dweller is, in large part, a myth seeded by the agricultural bias of the historians who came after them. But the body alone was not enough, because ancient humans were injured, often, violently, regularly. Hunting megafauna, mammoths, aurochs, wild boar, giant elk, was not a clean or safe operation. Skeletal records from Neanderthal populations, studied extensively by paleoanthropologist Eric Trinkhaus at Washington University, reveal a pattern of healed fractures that mirrors, almost exactly, the injury profiles of modern-day professional rodeo riders. Ribs, collarbones, skulls, broken and healed. These were not individuals who were left to die. These were people who were cared for, who had time to recover, who were fed and protected while they could not hunt or gather for themselves. What this tells us is something profound. Ancient human groups were practicing a form of social medicine that predates every pharmaceutical, every herb, every surgical instrument that would ever be invented. They were keeping each other alive. And that, the care of another person, is arguably the oldest form of medicine on Earth. Now let's talk about what they added to that. Because ancient humans did not sit still and wait for their immune systems to work alone. They observed. They experimented. They remembered. And across hundreds of thousands of years, they accumulated something that we now recognize as the first pharmacopoeia, a collection of plants, minerals, and behaviors that genuinely worked. The evidence for this is older than you might expect. At the Shanidar Cave site in northern Iraq, excavations in the 1960s led by Ralph Selecki uncovered the burial of a Neanderthal male, Shanidar IV, surrounded by pollen clusters. The original interpretation was that he had been buried with flowers, yarrow, groundsel, ephedra, grape hyacinth. These plants, the argument went, were placed intentionally. They are also, every single one of them, plants with documented pharmacological properties. Ephedra contains ephedrine, a compound still used in decongestants today. Yarrow is a well-documented antimicrobial and wound-staunching agent. The debate over whether this was a true medicinal burial or a natural deposit has continued for decades, but subsequent analysis of other Neanderthal sites has continued to find evidence of medicinal plant use, including a 2017 study in Scientific Reports analyzing dental calcite from Neanderthals in El Sidrón Cave in Spain, which found residues of yarrow, chamomile, and moss in tooth plaque. These are bitter plants with no caloric value. They were not food. They were consumed deliberately. Your ancestors, and the close relatives who came before you, knew about herbal medicine before Homo sapiens fully emerged as a species. Let that land for a moment. Now imagine you're an ancient human living in a forested river valley. It's late summer. A child in your group, not your biological child, but a child you've known since birth, a child whose father saved your life during a buffalo hunt 2 seasons ago, wakes up screaming at night. Her skin is burning. Her eyes are glassy. By morning, she cannot keep water down. What do? You already know some of this, because your group has been learning and teaching for generations. You know that the bark of the willow tree, when boiled in water and consumed, reduces fever. This is not a guess or a ritual superstition. This is an observation passed down across dozens of lifetimes. The active compound in willow bark is salicin, which the human body metabolizes into salicylic acid, the precursor to aspirin. Modern aspirin was synthesized in 1897 by Felix Hoffmann at Bayer. Ancient humans were using the source material tens of thousands of years before that. You know that certain leaves, when chewed and pressed against a wound, slow bleeding and reduce swelling. Anthropological research into surviving indigenous pharmacopoeias. Those of the Amazonian groups studied by ethnobotanist Richard Evans Schultes, or the Aboriginal Australians documented by researchers like Philip Clark, has found that at least 25% of modern pharmaceutical drugs are derived from plants that traditional societies identified and used medicinally long before Western science cataloged them. Quinine from cinchona bark for malaria, morphine from the opium poppy, digitalis from foxglove for heart conditions, Taxol from the Pacific yew tree for cancer. None of these were invented by pharmaceutical companies. They were discovered by people watching plants and noticing what happened. Ancient humans were doing exactly this, systematically, for hundreds of thousands of years. But the child is still burning. You do something else that medicine has only recently recognized as genuinely therapeutic. You hold her. You keep her warm during the night chills and cooler during the fever peaks. Not with ice packs, but by moving her in and out of shade, placing wet leaves against her forehead, managing her environment the way you would manage a fire. You keep the others away if you suspect contagion. You make sure she is never alone. You speak to her, and other people speak to her, in low voices, regularly through the night. This is not primitive superstition. This is applied knowledge of human biology. The calming effect of social contact on the stress response is well documented. Cortisol, the body's primary stress hormone, directly suppresses immune function when it remains elevated for extended periods. Physical contact, familiar voices, and the presence of trusted individuals reduce cortisol levels and allow the immune system to operate more effectively. A 2003 study by Sheldon Cohen at Carnegie Mellon University found that social support networks directly correlated with resistance to infection and speed of recovery in human subjects. Ancient humans were practicing social support medicine not because they read a study, but because across countless generations, the groups that kept sick members comfortable and connected had more survivors. They learned this the hard way, and they remembered it. The child survives. She will carry the scar of this illness, a slight weakness in her left knee that will remain for the rest of her life. But she will live to have children of her own, and she will remember, with more precision than any written record, what was done for her. Now let's talk about the part of prehistoric medicine that most people completely overlook. Surgery. Real surgery. Not metaphorical surgery. Not scratching a wound with a stick. Actual surgical intervention. The cutting of flesh. The removal of diseased or damaged tissue. The manipulation of bone. Performed by human hands with deliberate intent. The earliest known evidence of amputation was discovered in 2022, when archaeologists excavating a limestone cave in Borneo found the skeletal remains of a young adult, dating to approximately 31,000 years ago, whose lower left leg had been cleanly removed. The cut was not from an animal or an accident. The bone was cut, deliberately, precisely, with a sharp stone tool. And the individual survived for years afterward. The bone shows extensive healing. This person was operated on, cared for through recovery, and lived for a significant period as an amputee in a hunter-gatherer group. The research, published in Nature by Tim Maloney and colleagues at Griffith University, represents the oldest surgical amputation ever recorded, thousands of years before the first known ancient Egyptian surgical papyrus. But whoever performed that surgery knew something critical: how to keep the wound clean, how to minimize infection risk, how to manage blood loss, how to dress and protect a healing stump over the weeks and months that followed. They didn't call it sterile technique, but they practiced it. Natural antiseptics were well within the knowledge base of many ancient cultures. Honey has been used as a wound covering for at least 8,000 years. It is documented in ancient Egyptian medical texts, and its antibacterial properties are now understood to come from its low moisture content, hydrogen peroxide generation, and low mud from certain mineral-rich riverbanks contains clay compounds that bind to and neutralize bacterial toxins, a phenomenon only recently explained by modern biochemistry. Pine resin, pressed into wounds, creates an airtight seal that prevents contamination while its terpene compounds inhibit bacterial growth. Ancient humans in northern climates were using pine resin as wound sealant before written history began. And then there is the question of pain. How do you perform surgery, or even set a broken bone, on a person who is screaming and fighting you? You already know the answer if you've been paying attention. Certain plants contain compounds that dull pain, induce sedation, or produce dissociative states. The coca leaf, source of cocaine, was used for thousands of years by Andean peoples to manage pain during procedures and physically demanding labor. The opium poppy was cultivated in the Middle East and Mediterranean as early as 5000 BCE. Datura, henbane, and mandrake, all containing alkaloids with sedative and analgesic properties, appear in medicinal traditions across Africa, Europe, Asia, and the Americas. The Ebers Papyrus, one of the oldest known medical documents at 3,500 years old, describes opium-based preparations for pain management in surgical contexts. But here is what truly separates prehistoric medicine from what you might imagine. It wasn't guesswork. It was a system. Across every traditional society that has been studied by medical anthropologists, from the Aboriginal Australians to the Amazonian tribes to the Siberian Evenki to the Lakota of the Great Plains, medicine is never random. It is codified, transmitted, specialized, and rigorously selective. Every society had people whose primary role was medical knowledge. You call them shamans, witch doctors, healers, or medicine men depending on who's writing the anthropology textbook. But the more honest description is, these were the people who spent decades learning, testing, observing, and memorizing the medical knowledge of their group. Anthropologist Wade Davis, in his extensive fieldwork with traditional healers across multiple continents, found that the botanical knowledge held by experienced traditional practitioners regularly exceeded the pharmacological knowledge of trained Western physicians in their domain. A healer in the Amazon who has spent 40 years learning the medicinal properties of the plants in a specific forest knows that forest's pharmacy, its active compounds, its safe dosages, its contraindications, its harvesting seasons, in a way that no outside scientist has ever fully mapped. This is the form of medicine that ancient humans practiced, and it worked. Not always. Not for everything. The mortality rate was real. But it worked often enough, and well enough, and systematically enough that a species without a single pharmaceutical drug survived every ice age, every epidemic, every pandemic, every injury, every difficult birth, and every famine for 300,000 years. Now let's reconstruct one more scene. A woman. She's 28 years old, which is not old in the way you might think. In healthy hunter-gatherer populations, once an individual survived childhood, average adult life expectancy was not as catastrophically short as is commonly believed. Studies of skeletal aging by researchers, including Rachel Kaspari at Central Michigan University, have found that by the Upper Paleolithic, roughly 30,000 to 40,000 years ago, there was a dramatic increase in the number of older adults, grandparents, present in human populations. This demographic shift, more grandmothers, has been proposed by anthropologist Kristen Hawkes as a key driver of human cognitive development. Grandmothers who survived past reproductive age contributed to group knowledge, childcare, food processing, and medical memory. The older you got, the more you knew. And the more you knew, the more valuable you were. This woman is giving birth. Childbirth was the leading cause of death for women of reproductive age across most of human prehistory. That is a real and brutal fact. But ancient human groups were not passive about this. Midwifery, the attendance and assistance of an experienced woman or group of women during birth, appears to be one of the oldest specialized roles in human social life. Anthropologist Wenda Trevathan, in her research on the evolution of birth assistance, argues that the shift to bipedalism, walking upright, altered the geometry of the human pelvis in ways that made birth significantly more difficult and dangerous than in other primates. This, she argues, created evolutionary pressure for assistance during delivery, and that pressure was felt hundreds of thousands of years ago. Ancient birth was not a solitary ordeal. It was a group event. Experienced women guided, supported, repositioned, and intervened. They knew which positions reduced complications. They knew how to manage a baby who wasn't turning. They knew what to do with the cord and the placenta. They had almost certainly seen more births than most modern obstetric nurses have. The woman gives birth to a healthy child. She is exhausted, bleeding, and at high risk of infection in the days that follow. She is not left alone. She is kept warm. She is fed high-calorie food by others who hunt and gather on her behalf. She is given medicinal preparations. The specific plants depend on where in the world this is happening, but the pattern is consistent across cultures. Antimicrobial plants applied or consumed, rest enforced by social structure, pain management offered, and constant monitoring by experienced women who know what the warning signs of postpartum infection look like. She survives. Her child survives. And one day, her child will watch her do this for someone else and will remember. That is how medical knowledge traveled for 300,000 years. Not in books, not in databases, in people. In carefully observed practice, painstakingly transmitted through close relationship, encoded into the ritual structures of every culture on Earth, because ritual is one of the most effective mechanisms for transmitting critical procedural knowledge across generations without writing. When you wonder how ancient humans survived without medicine, you are asking the wrong question. They had medicine. It was older, stranger, and more deeply embedded in community than anything you get from a pharmacy today. It was rooted in an understanding of plants that modern science is still catching up to. It was supported by a social architecture designed, without anyone designing it consciously, to maximize the chances of survival for every member of the group. It was performed by specialists whose entire life's work was the accumulation and transmission of healing knowledge. Was it perfect? No. Infant mortality was high. Injuries that a modern emergency room would treat in 2 hours could kill in a week. Systemic infections that a single course of antibiotics would eliminate could take a life in days. Ancient humans died from things that would not kill you today. But here is what is true. Every time you reach for that white pill in the cabinet, that precise, synthesized, pharmaceutical miracle, you are taking the last step in a chain of medical knowledge that is 300,000 years long. The compound in that pill was found in a plant that someone, somewhere, at some point before written history, watched, tasted, crushed, pressed into a wound, brewed into a tea, and gave to a person who was suffering. It worked. They remembered. You are here. The headache you started with. The one that a small white pill can erase in 20 minutes. would not have ended your life in the ancient world either. Your ancestors would have pressed willow bark tea into your hands, laid cool leaves across your forehead, and sat with you in the shade until it passed. The pill is faster, but the instinct to help, to find the thing that heals, to pass it on, to make sure no one suffers alone, that instinct is not modern at all. That is the oldest thing about you.